Welcome, ladies and gentlemen of the media. We'd like to apologize for the long delay. We are in exceptional times. I thought you are ready. Where you are? You've been ready, ever ready, huh? Commanders in the field. Okay, are you ready? How you are, my guys? Set, sound, action. Are you set?
Yes, thank you very much, viewers. As you're watching, welcome to this special update again, as you have been following. Of course, yesterday, that the ministry promised that they'll be giving the Gambian public updates on the current situation of coronavirus in the country, and we are about to go live at, of course, the medical center stores in Kotu, where the of course the update is about to take place. As you have been of course, as you are watching the images there, the emergency team is about to relay the latest information about the situation of the coronavirus. With that,
we are in exceptional circumstances. Without wasting much of time, I would like to invite my director to brief you. Welcome.
Thank you. Okay. Thank you very much, Prince Abubakar Sankano. Welcome, colleagues from the media. And once again, I want to apologize on behalf of the Honorable Minister for Health for the delay, and then we wish to apologize sincerely for keeping you here for a while, and we do hope that such incident will be avoided in our subsequent activities. I am also reading this report on behalf of the Honorable Minister of Health, Honorable Ahmed Lamin Samate. And then, as you know, we always have a daily briefing on the situational report. And it will be recalled that we did, our fourth report was there to you yesterday. And today I'm going to give you the fifth report. I want to give you first the highlights. And this is the fifth national situation report since the confirmation of the first case of the novel coronavirus COVID-19 in the Gambia on the 17th of March 2020. I will also give you the national situation just to inform all of you in the entire country that we also have one new laboratory confirmed case recorded. We also have cumulative. The country now has a total of 3 COVID confirmed cases. All 3 confirmed cases are imported with no epidemiological link to each other. There is high partners meeting held at the UN House to discuss the way forward. That was also done. The Indus case is on treatment at the Medical Research Council and is responding to treatment. I gave you details of the Indus case. That was the young lady, and I also gave you the case of the Bangladeshi national. That was also given to you, and I will also now go to the third case, which is a 71-year-old Gambian of Upper River Region area of Numuyel, who recently returned from France, arrived in the Gambia on the 17th of March 2020 at 1:31 hours by a TUI Akifly TF with flight number TFL 458 and traveled to Numuyal. How he traveled to Numuyal is not yet clear to us, but our team are also investigating that to find out his route of travel from the airport to Numuyal. In that particular flight, there were 59 passengers were on board. According to and also the manifestation symptoms began on the 20th of March 2020. He first reported to the OPD of Basse District Hospital with symptoms such as abdominal and chest pain in the early hours of the 21st of March 2020. He was escorted to the hospital by 2 escorts who brought him on a motorcycle. He initially resisted sample collection, but sample was later collected on the 21st of March after the intervention of the PIU, the Police Intervention Unit. Sample sent to MRC at Fajara for testing on the 22nd of March. The result became positive and received on the 23rd of March. He is currently on admission. And this information came through us as a result of the follow-up we are doing and the contact tracing, and as well as the epidemiological investigation. And our investigation results revealed that 19 close contacts of in the second case, which was, we remember, we had the second case, and then these are people who are also on the quarantine. And those people are also going to be tested, including 6 healthcare workers. The flight manifest also came with us and is obtained, and contract tracing has also started. We also want to assure you that information also will be available to you on time. And now, as we said, this period briefing will still continue from Monday to Friday with the stipulated time of 12 p.m. on a daily basis. I also want to give you the summary of what we have. With regards to quarantine, we have now 2 new additional people who have been quarantined, making a total of 133 people are now on quarantine. For those who completed follow-up of no symptom with travel history, and also asymptomatic with people with travel history to affected areas, they've also completed the follow-up, and they are still remain 310 people. Contacts traced, 573 people. Confirmed cases, the one we have yesterday, added to the 2, now we have a cumulative of 3 confirmed cases. Deaths, we still have 1. Total tests conducted, 22. And positive test result yesterday was 1. Adding to the 2 will be now is 3. The negative test results are 19. And I will also want to also inform you that the EFHTH mortuary and Maracas have been fumigated. 12 samples were collected from the residents of Maracas, including the 3 co-travelers who are currently quarantined, and the samples are sent to MRC Gambia laboratories. Tracing of contacts of the index case is still ongoing. A team of experts, including personnel from the National Public Health Laboratory, Epidemiology and Disease Control, and the Director of Health Promotion and Education, selected to travel to URA in order to reinforce response efforts have also been taken. All health personnel who came in contact with the second case are all quarantined and had their samples collected. We're also going to give you daily situational report. We also promise you, and this will continue regularly on various platforms. And we are also in the process of having this situational report in the local languages to be relayed on radio, television, print, and as well as local and social media. We also want to continue the daily press briefings, which are still ongoing, and we will also reinforce it. We also put up what we call the U-Report poll, ongoing, to assess the level of understanding and to inform the public on the COVID-19. The U-Report has been developed by UNICEF in collaboration with us, and it's just to gauge the understanding of people with regards to the information they are getting on coronavirus. Information sharing ongoing on the Minister of Health's social media pages, both Twitter and Facebook. Additional risk communication support material with messages and banning of public gathering developed. 100 clinicians oriented on risk communication. The volumes of calls to the toll-free number 1025 hotline is massive. And I want to give you a summary of the volumes of calls, the volume of calls that have been coming. Summary of calls received on 1025. 453 calls received related to reporting possible suspects. 875 calls received related to inquire on signs, symptoms, and prevention. 3 calls related to self-reporting, while 128 calls not related to COVID-19 at all, and 37 calls referred to contact tracing team for follow-up. The next steps and recommendations. All contacts of the new case to be traced, line listed, quarantined, and tested where case definition is met. We will continue with the tracing of the contacts, including mortuary attendants, line listing, quarantine, and testing of suspects and that meet the case definition. Fumigation of Bundung Maternal and Child Health Hospital and the ambulance that carried the corpse. Fumigation of Basse District Hospital. SOP for sample reporting system to be developed and implemented with immediate effect. SOP for burial to be developed and disseminated. Training of sample collectors, drivers, mortuary attendants, personnel responsible for EOC, that Emergency Operations Center, and security personnel on COVID-19. Specific executive directive to suspend congregational prayers should be given and implemented, and as well as enforced. The shift work of 1025 hotline handlers, contract tracers, RRT, and other EOC members. We also expand the need to expand COVID-19 testing facility to the National Public Health Laboratory, BL3 laboratory. Rapid assessment tool developed and shared. Refumigation of the airport and fumigation of the Public Health Emergency Operations Center will also be conducted. We also have all teams and sub-teams to report to safety and security unit for security briefings and advice prior to movement. This is also something that we're also going to institute. Increase the number of handlers of MOA social media platforms. Other partners are also willing to support us in this area. We also want to recruit additional personnel for the purpose, including contact tracers and rapid response teams. So far, so good. This is what we have for you today. And to emphasize again, we have additional case yesterday, now meaning Gambia is also added onto the list of countries that are reporting cases, and we now have 3 cases, confirmed cases. Thank you for your kind attention.
Thank you very much, Director, for that elaborate update. You said something very important, that is disaggregating the information in our local languages. And as you know, URR is a region which actually is affected by those who speak Sarahule and Fula. And without wasting time, we would like to start with the first version of the local language, which is because it has a high concentration of people who have been calling since in the morning, but we told them to wait for the official briefing. Now that it is official, confirmed that the Gambia has 3 cases, and this one is in a region where Sarahule language is speaken. I would like indulge your audience to give me the opportunity to explain this information in Sarahule, so that those who understand Sarahule can actually get the correct information. mare moga kunyini masakunda ko lakhe marantenga yonkin sahanga kwana masakunda gara ko lakhe besigindi marantenga ko emergency yonkin sahe barenga kebe gare direct be marantenga yonkin sahantu aunga na mare muntu kha tu mo be ke jangiro be gara ko Gambia ga mo be sa so sikki ara kunya kita bane mfati ke kes be ga giri numuyeli firsenya na uyunga tanyere do sina bane agri Francia akinye Gambia ke tubabon khaso match ata mundo nyeru agari abio be di Kenya tui ake flight abio ke nombani TFL kamona kat tankarage sebu 487 aga giri adaga numiyel mo be o ma ken tu hinano do ken kiskisi nyama ma daga private nyama daga passenger nyama do ken kiskisi nyama ado soro be no gari dome abio kedi e tankarage do soro kabi kunyanyi abio bane ado kunyanyi abio bane so ake da toye njop nda joppa khaso ke tampille nya adaga base loptanindi ila krosi ati giji menyani wata ken daga ma khaso ke tampille ndo bane ila krosi kha iri atunci motonga bebenga ko motorcycle ngano ngani soro hilira tunci no ngani so igati wajara na igati ko wa hore mutu wala hoy abara mancha kunda gol nyangano maga so Kenya ni herentai ma ina police nu nyaaki ko PIU para nu nyaaki pour ina adia kuya nkorosi so igara korosi igara hore nda hatem po mutu igara korosi ni dengi MRC boy laboratory kena no nye egara ha MRC da ida dengi MRC kaso ke tampilendo hillonya match so abita landinga kaso ke tampilendo siko Kenya da tenenge ke kondo ora hido kulen kita nanti jangiro ke waya khayo ke dima bay abama sakitendi wa korosin so Kenya har samare mono hakkelen taawoni ono kilun to ke jangiro ni sahaba nyai igara humbenu ko ona entretiken. Thank you very much, my director, and thank you all for giving me the opportunity to explain this in one of the local languages. And now the floor is open for follow-up questions to our director, Stanjai.
So I'll start. And mine is I have a few questions, but I'll ask one, and I want to put something also across on behalf of journalists. So first, my question is, why did it take the authorities, why did it take you this long to tell the Gambian people that there is an extra case? Because this case was confirmed yesterday. Why did it take you this long? And then my comment on behalf of every journalist is that, like everybody else, journalists have their sources, they have this information. Some of us had this information, this case, the third case since yesterday. You've not seen it in any media. I'm not talking about social media individuals, but you've not seen it in any media in this country. Not because we cannot do it, but out of respect for protocols, because this is not just journalism, this is about humanity. So we want to respect the protocols, we want to respect the authorities, and we want to join all of you, all of us together as Gambians to fight this. But what is clear is that if this trend continues, you confirm results and you want to take your time and not tell us about it, you don't want to confirm, you don't want to do anything about it, I can assure you journalists will go ahead and do what is incumbent upon them. So my position is, can we work together and find a solution to this? First of all, journalists come here, the last time they were here for 8 hours. Today they were here for hours. And we don't want this to continue. No one knows when this virus is going to end. It might drag on for months. Are you going to bring us here every day and keep us here for 8 hours, for hours? I mean, it doesn't work like that. There is a lot of anxiety. There is a lot of fear outside. So if you want to do things like this, it doesn't work for journalists. And unfortunately, if this trend continues, we will break that protocol. Whatever respect we have for the protocols, we cannot go. We will not continue to respect them.
Thank you very much. Give the director Modunja the chance to answer, and I'll add up, when necessary. Thank you very much for your concern.
Oh, thank you, Sri Bojan Junior. I think when I came in and I found you people here, the first thing I did was to apologize on behalf of the ministry. And if I apologize on behalf of the ministry for the delay, I think we need to understand that I'm speaking on behalf of the ministry to apologize on behalf of the minister. We know there are delays, but we are dealing with information. We have to take our time. We give you accurate information. We don't want to give you information. Tomorrow you go back and tell us again, oh, you said this, and today you are saying this. We want to be very consistent. We want to be very reliable. And our source is a credible source, and we want to maintain that credibility we have in terms of giving out health information. Yes, the delay is there because social media, we cannot control it. Whatever is there, that's what they feel. And let me tell you one mistake that happened some time ago. The first case, they said it was a 21-year-old. That went on social media, followed by 1 or 2 points that we ended up not having that in our final report. The lady came to be 28-year-old. We got a lot of facts about it before we came to report. And when we reported, that was I would say the most credible report we had. And wherever you go, that's the information you get. But the social media report that came first gave us a misleading information about the age of that particular individual. That's the first case I'm talking about. So this is what we want to avoid. This is why we said we might have some delays, but also, I mean, the minister and the team had an emergency meeting, and the minister wanted to be here himself. And we want to give him that respect for him to come here, and even read this statement for you people. That's what we wanted to do. Not that he's the one who delayed it. It is me who said, let's allow the minister to come and give us a statement.
Yeah,
no, wait, I'm coming. And when the delay happened, we sent our staff to come and apologize to you. When we were also working, I was with him to try to sort out certain information. Yes, there was a delay. We said we are sorry. And what we have foreseen, it will not happen again. I mean, we want to have a very good working relationship with the journalists in this country. We're saying that it will not happen. I am speaking on behalf of the ministry that these delays that has happened will not happen. We've been 12 o'clock. We're going to give you information at 12 o'clock. That's what I want to tell you. Anytime we meet here Monday to Saturday, we will definitely endeavor to be here and give you information by 12 o'clock. We are sorry for what has happened. These are human nature. Sometimes we also have to follow certain protocols before we come out with certain information. Because if you send certain information, then it turned out to be false, then the problem comes back to the one who sent the message. That is where we find ourselves. But it doesn't mean that it's intentional to keep you here. It is not an intention at all, because we know that you have been our friends from the start. Health has been, I think, one of the ministries that is very close to the media. You know it, Serif, more than any other person. So we don't want to break that relationship between us as a ministry and the media fraternity. We want to definitely assure you that it will not happen, and we will continue to keep our relationship. On behalf of this, I'm just speaking on behalf of the minister.
Okay.
And then you said, you asked her, why did we take, okay, I answered that question. Yeah, the working relationship, be rest assured, is even going to be sweeter. Because
May I suggest?
Yeah.
Sorry guys, I know a lot of them want to ask a question,
Yeah.
but just a quick suggestion.
Yeah, it's
It's
okay.
safety issue. Because, look, the protocols, WHO protocols,
Yeah, 1 meter, yeah.
all of us are exposed to this.
Yeah.
Can we have a situation in which journalists don't physically have to come here?
Yeah.
You can send speedy, accurate information on the social media.
In fact, that's what we have discussed.
I mean, personally, I don't know. You've been in and
Anyway.
out of government, I don't trust you, so, we don't have to come here all the time, and all of us, face this venue. So you can send,
No,
people
Siri.
who want to do follow-up can come.
Now, in fact, exactly that what you are saying, that's what we were discussing also. So that when we come back to you, we give you recommendation, and this recommendation we are going to discuss it with the minister, so that anything we have an official Facebook page, and we are happy that all of you are accessing our information. We'll just put it there, and you pick it, and then you publish. If you have any doubt, you can come here, have a one-to-one interview, then we can allow that. But at least what you are saying, in fact, we discussed it today, myself and Sankano, and the team, and then definitely we are going to work on that. So thank you for that, and it's already something that is already in our minds. Okay? Thank you.
Thank you very much, Director. To emphasize, Bertel, we apologize for all the shortcomings. We are all overwhelmed, as you can see, and this is a global phenomenon. Even the superpowers were overwhelmed. What we are doing our part, you are partners. We cannot win this battle against Corona without your support. So bear with us. I mean, we are all suffering. I mean, what will all succeed and be happy. What you say, the issues that you raise, I mean, the government is aware, and that's why the Ministry of Information and Communication Infrastructure is involved in the National Health Emergency Team, and that's why I'm here so that we can filter your recommendations, your suggestions as GPU. You can put it into the writing, so as you know, the government bureaucracy. But we've been getting a lot of information, you know, since yesterday. Social media, that is the banter, but we can't do anything. But we have to verify as government, as credible. We don't want to give you information as directors and after we come, because I get a different information before we came here, but I decided to wait, you know. We decided to wait until when we come here. It is important because we have to do a lot of back and forth, cross-checking. Information is fluid, and we can't do anything about it. All we can do is to take our time, you know. And we thank you for respecting the authorities, for holding back information, and even before your deadline, anytime you need information, call us. 24/7 we are here. We don't go home at times 3 a.m. So we are at your disposal. You know, don't just be satisfied with the daily briefings, but our lines are open. We are building a media center. Be rest assured that, you know, the situation will improve. What you talk about, you know, distance, you know, press briefing is something that is being prepared right now. As you can see, technicians fixing, you know, computers. We discussed that one today. So we care about you, and we apologize that you've been here. There's not even water to drink, but we hope it will be improved. And so if there are some subsequent questions to ask, you may ask, so that it won't take much of your time.
Okay, just a follow-up question to what Sheriff asked.
Yeah. From your media organization?
Paradise. My name is Landin Sise.
Okay.
Is it that you people don't have human resources that can verify information for you to share with the media in less than an hour or just 2 hours? Because based on the information that I receive, and I know most of us receive the same information or similar information, that the third case has been confirmed since 7 p.m. yesterday. So look at the duration, 7 p.m. to 10 p.m. I think if you have human resources, you can share the information to us as early as possible, so that, you know, this speculation and fears in the society can be reduced. So I want to ask whether you people have the human resources to gather certain information to share with the public.
Yeah. You want me to respond? I want to take another one. Yeah, let's just take 2 or 3 and I'll respond.
Thank you very much. I am Omar Ba, people to understand what you speak. People are already beginning to worry about the fact that the ministry not giving any information about where the force of corona casualty contracted the virus. It has been an issue. Whether you have any update about that, where you see contracted the virus, and if not, don't you think this is a time for whole leadership? Meaning, with the ministry, does the ministry think that we have reached a point where they should recommend to the president to declare a state of emergency, at least by imposing a sensible coffee that is not realistic and of course impossible.
Okay. Can I respond to that, Mr. Omar Ba? That's a very good suggestion. We're just saying that the first case, we made it very clear that she is a Gambian who went to United Kingdom for mission on the 9th, and she came back to the Gambia by barely about less than a week, and then she falls sick. Yes, we will not be able to tell you where she contracted the disease from. That will be difficult for us. But we can tell you that she was concerned, and she felt that she was also having some signs that is similar to the WHO clarification for coronavirus, and she had to do self-referral. That was done. But as it point in time, we are still investigating. But that we can only know that when she's stable and she's comfortable, she sit down, then she can tell us where she has gone. The one can be able to do that. But at this point in time, she's on admission, and we have to take our time. And then all pray that she comes out okay, and then we can get the right information you want. But for now to say that where she got it from, that will be difficult for us, because we know that she might come with it, or she might take it from somewhere and go with it. We don't know. But we know that she came from UK. But we also need to find out her travel history, well before UK, where she has gone. But that can only know that we can only know that when you sit with her and talk with her. But as of now, we have to give her a chance to recover. When she recovers, then we'll get the information we want. We are here for the next few days or so, and as we get the information about each and every one of the cases, we'll get back to you on that. We'll inform you accordingly. This other one talk about human resources. We have the human resources when it comes to information. We have laboratory. We have this rapid response. We have the contact tracing. We have the surveillance, case management, and communication. It's a network. And we have to make sure that we verify each and if information comes from Upper River region, the surveillance will not sit down alone and jump to conclusion and make a conclusion and make information or provide information that to say that this is the right information. If they provide another level, team will also go to from another level to verify that information. The laboratory also will get up and also go back to the records and verify, and then we come back and communicate and network. Sometimes these are the delays, but as you know, in emergencies you don't jump. If we give you certain information that is not the right information, it is you, the journalist, again, who will come back to get us again and hold us by our neck and say you said this before and it's not correct. And that's what we want to avoid. We want to respect ourselves. When we give you information, we don't want you to come back again and say, hey, Mr. Njai, you said this. This was not what you said yesterday. Because I know people like you are fond of doing that. You come and tell me, hey, Mr. Njai, you said this yesterday, but this is not what you're telling me today. But we are very careful. That's why we said, when we are coming to you people, our friends, we'll come back with clear information, very reliable information, so that wherever you call and knock, they will say, yes, this is exactly what is happening. Today, when you call Basse, they will give you the same information we gave you. You go to the laboratory side, they will give you the same thing. The surveillance side, the rapid response team, the contact tracing, they will give you the same information. That's what we all go and sleep. But otherwise, when we give you something wrong, it is Mr. Njai who gave us this thing, and you start calling. Sometimes when I ask him, we don't sleep. We receive calls up to 4 a.m., 5 a.m. Sometimes we are in the office here. Who knows when we leave here? We just want to make sure that people are satisfied. Journalists are satisfied. And no journalist will say, we have called Mr. Njai or we call somebody, the Minister of Health, they don't take our calls. We are doing our best to respond to information that is supposed to go to you people. But definitely be rest assured the human resources there, and then we are even getting people who are also less busy and they're in other areas. We in fact try to recruit them for surveillance, for points of entry. We are trying to strengthen all the areas. That's what we are doing right now. Human resources definitely not a challenge when you come to code, but we just need to coordinate our communication. And when we also get that information also, we have to take it to the next level. The next level is who? The permanent secretary will be informed, the Director of Health Service will be informed, all the line directors will also be informed, and it goes to the minister for review, and the Honorable Minister now will also take it to the next level for information. But the technicians also will be there to act on it. That's what we are doing. You see, in health we work in channel. And the channel is not like cumbersome enough like you may expect, but it's just a way of just telling the right information, consistent information and reliable information, so that tomorrow no one will be held responsible for mistakes and so on. So we are sorry that the delay is there, but I said at the beginning of my statement that we are very sorry for the delay in coming to you to give you information, but it will not happen. And in case also we have information on certain issues, we are not promising that we are going to come back to you early to give you, like for example, if it is a positive case, we don't want to give you information to say if it is 10 o'clock at p.m. we'll come at 10 o'clock or 10:30 or 11 o'clock p.m. We have to go back the next level. We said 12 p.m. That's the time perhaps will be the most suitable place to give you the information. But now that we are changing our strategy, when you confirm it before you go to bed, I'm sure when you go to the page, our different pages, you will see the information that then you can start. If you are also in doubt of that information, then you can call us for us to clarify, or you can even arrange one-to-one interview. That one we are very much open to that. Is that okay? Are you happy with my response? No, you are not happy? Yes, because a state of emergency to be declared. Senegal, I know you will quote Senegal. How many cases do they have? Over 40?
79. Are we going to...
No, I'm not coming. I'm coming. Now we are saying one of the strategies is to close the borders. There's another way of preventing the disease to enter. If it is to come through either by land or by air. That's one. That has been done. I think people should also applaud the government for that. That's one. We also have suspension of gatherings. Either religious, whatsoever, must also be suspended. But you and I knows it's still a challenge. How can the government come up with a state of emergency when people in this country are also not even helpful to government? Helpful to government in the sense that trying to help people now, and people are harboring certain people who have escaped from our quarantine centers. People are still harboring them, and they're in this country. People are still harboring people who came through certain routes, and they're in their houses, and they're keeping quiet. They only call us when they see certain signs in them, or when they see that they feel a bit sick and they start calling us. Is that helpful to government? Now I'm just asking, is that helpful? It's not helpful to all of us, because you don't know whom you are staying with in your house. You don't know. The person can come with a disease, but let's try to come out clearly and help people. In the state of emergency, it has to take certain procedures. I said it here, International Health Regulation 2005, its implementation requires a step-by-step approach. You move from one level to the next level to another level. You don't not just bang on and start implementing it. Countries, that's what they do. And we are signatory to it. It's an international document. We signed for it, and we have to respect it. So when the state of emergency will be announced, we cannot say it at this point in time, but we are also monitoring the situation, and we'll get back to, even whereas also we are going to go out of this condition, we are also monitoring, and we'll also come back to you and say, we are okay, we can do A, B, and C. Last China did. China was going out, and they start opening shops slowly, and they start doing certain things slowly. They were also caught up by surprise. As a developed country, they were caught up by surprise. Much more developing countries like the Gambia and other countries. No health system in this world is perfect. Let me tell you this. No matter how rich the country is, they cannot also be able to meet the health demands of the population. You talk about health insurance. Who is paying for the health insurance? It is government. You talk about other facilities for population. Government takes responsibility. And it's expensive upon government to take care of healthcare service delivery. So it is people who should also help us. But we are doing our best. We will give you information, and when we reach to a level where we need to announce a state of emergency, the ministry will now advise government as to what to do. Government decision will come from the advice from the Minister on technical matters. Look at the implication of a state of emergency. Look at also whether to do emergency, look at the implication. We have to weigh it, the benefit and then the disadvantages also. So those things will happen, and when we do, whatever we plan to do, we'll tell you. In our this summary, we always tell you what we want to do. If you listen to what I was reading.
Well, that is the ongoing press conference of the Ministry of Health, and of course on the update of the coronavirus situation in the Gambia, of course, right there at the Center Medical Stores in Kotu. And of course, the response team have confirmed that the Gambia has, of course, confirmed its third case in the Gambia. And of course, that is the the highlights of today's press briefing. Of course, updating the media and on the current situation of the coronavirus in the Gambia, like I said. And of course, as you heard from the director, the man, of course, is a 71-year-old Gambian who is currently in Numil in the Upper River region, and he's a Gambian, by the way. And not long ago, he came from France, and eventually, after tests were conducted, he was results proved positive. And now the positive cases have gone to 3 in the Gambia, and of course there are other people that are still under quarantine, other cases still been of course been checked or been processed and all that. And we have over 500 trace cases in the Gambia, as we had from the director just right away. 22 tests cases are conducted so far, as you also heard from him. So that is the situation. The breaking news of the day on the update has been that Gambia have confirmed another case of the coronavirus COVID-19 in the Gambia, making it 3. Of course, the fourth case of 28 old Gambian who came from UK. The third is a Bangladesh who, of course, unfortunately passed away yesterday, or was it on Sunday? And then, of course, now the third case has been confirmed. So it looks like the numbers has beginning to escalate. We would, of course, be talking to our team on the ground any moment from now to have more details on the other issues that have been discussed as the press conference is still going on. Question and answer from the media personnel and of course the director of the health service, who of course or should I say the head of the emergency response committee team. You know, he have of course also said there has been 19 negative test results that have been also confirmed, and he have reiterate the government position also to continue updating the Gambian public on the current situation of the coronavirus in the country. You know, journalists raised concern on the delay of time and all that, but I think we'll come to that later on. But of course the most important thing right now to talk about is the confirmation of another case in the Gambia, which I know of course would trail some other people back, because you know, I know people would start to be more worried about the situation, but then especially now this case has been confirmed in the other side of the country, in the provinces, that is in the Upper River region. And of course another interesting thing that he mentioned, this man that have of course jetted through the Banjul International Airport, traveled to Basse via of course you know, a car, and of course you know whereby of course about 59 other people were in, or should I say 58 and 59 passengers in the vehicle that took him to Basse. So who knows what's the situation right now in the area. But he's like he said, they are sending more medical personnel to go and support you know, the situation in the Upper River region, because they are tracing now people, and of course trying to know who he contacted and all that. Our man on the ground, Ibrahim Presba, is live on the line, and of course he can tell us more on the highlights of the today's press conference. Thank you very much, Ibrahim. Again, another long day today. The breaking news of the day is that another confirmed case in the Gambia, as we just heard from the response team.
The number of confirmed coronavirus cases in the Gambia to 3. And as we hear from the health ministry just now, that this is also another imported case, because the patient actually is someone who flew all the way from France to Banjul International Airport since on the 17th March. This is also a day, the very day that Gambia confirmed its first case, which was as a result of a traveler from the United Kingdom. So cumulatively, we have 2 cases from Europe as through the Banjul International Airport, and this time it is not within Banjul, because this is a traveler who at the airport and then took away to the regional provinces. That is the Upper River region.
Well, critical situation we are in. It looks like this man get into Gambia, and of course, and having you know, traveled all the way to Basse, where he's been checked and found positive. It looks like we are in a more critical situation than before, as the spread of this virus is concerned.
Yeah, indeed, Amadou, because this case could be analyzed in 2 aspects. The first being the plane through which he flew in the Gambia. We already understand that the total number of passengers in the plane, excluding the crew, were 59 in number. And all these people were coming to the Gambia or landed in the Gambia. So in fact, the Askai flight, you know, with the number given, you know, was never mentioned as to the cases. What we knew before was the Morocco airline, which brought the patient who flew from the United Kingdom. But now this is another flight which in which 59 passengers boarded, all for the Gambia. So who are these people? So the ministry keep talking about contact tracing, but now there is a real work as to what contact to trace. 59 minimum is from the plane, and these are the people who landed in Gambia. Away from that also, the ministry could not tell us as to the method or the means of transport that the patient or the Gambian who returned from France use all the way to Basse. This is about more than 400 kilometers. And, nature of transport in the Gambia, if it is, unless if he had used his own private car on self-driving, then the situation could be worse.
Yeah. Well, indeed, the situation could be worse, like you said. Do you think this will, of course, aggregate the fear of people looking at the situation now that, the third confirmed case is in the Upper River region, where, of course, medical facilities is not as good as people may want?
Yeah, this will absolutely aggravate the fear and concern that Gambians have over the outbreak of coronavirus. So the nomenclature of the virus being pandemic will really be a concern in the Gambia, because as you know, the rural areas, we talk about socialism in the Gambia, we talk about how people are friendly. In fact, it is a smiling coast of Africa. So within the urban areas, one can see that people are more business minded, and it is in very rare cases you have time to interact with other people. But in the provinces, rural Gambia, there people share everything. They share food, they share the prayer ground, they share the jokes and everything. So this is a man who traveled from France, and locally we would call them the semester, some eritoni, someone who is maybe well off, was away for some times and then come back. The nature of welcome will be, enormous. And then imagine two people escorted him to the health center on a motorbike, and this on a motorbike, for example. Yeah. So this is the real situation of the Gambia, and definitely the level of engagement or the interaction with local people around the regional areas will be enormous.
Yeah, it's worrisome because of the way we will live. And again, if you look at the numbers, it looks like it's increasing on the number of people quarantined, people that have been traced, and now we have case number 3. Do you think government now need to reposition itself in terms of dealing with the situation of the coronavirus in the Gambia?
Yeah, this is a very good concern, because already, in fact, even before there was a case confirmed in the Gambia, the health authorities appear to be under pressure. So there you easily hear the lack of face masks, the lack of materials, the lack of funds. It's been talked about. What about at the moment now where the number of cases are multiplying? Who knows if they have much more other cases? What will happen with the Ministry of Health right now? So we complain of the late start of today's press conference, and they say it is not just automatic. They have to do one or two things that could have been done by one person. 10 people are expected to do it. So this is the kind of explanations we get from the Ministry of Health. And just last week, the talk of town was about the people jumping quarantine centers due to lack of facilities there. So if the system is the same, for example, now, there should be a concern that, there is a serious situation in the Gambia.
Well, another thing, Gambians have been so much concerned since the demise of the second case. Of course, and, the director, Mr. Njai, talked about the markers. What more can you tell us about that?
Yeah, since yesterday, Mr. Njai, who is Director of Health Promotion and Education, has been calling for the need to close prayer grounds. Gambia is a very religious country, and then schools of thought differ as to whether mosques and churches should be shut down or not. Although, learning from Senegal, they have instituted or came up with a curfew last night, and prayer grounds like Friday prayers, the observance of it has to now be temporarily ceased. I don't know what will come up, because here the song repeats itself, but we've not seen drastic action taken. Maybe there are consultations with religious scholars because it is a critical issue when you talk about issues that concerns God and not human being.
Yeah.
We are practicing, and that's what we hear from Gambians. So this is one aspect of the coin, but we hope that, whatever move to be taken now, the situation is getting more real by day, and this is likely to continue. So the Ministry of Health has a big task to do in terms of preparedness.
Absolutely. And another concern probably we need to talk about, which he raised about, is the lack of support from Gambians, the people. He talked about the 17 people that have escaped from the quarantine center or hotel and eventually get, into homes, and people keep them in houses, which is, I think, is very dangerous. And he have talked about it and raised it as a concern.
Yeah, so that was from the Minister of Health and Social Welfare, who in his statement to inform Gambian of the second case, gave a stiff warning that those who jump out of quarantine centers should definitely consider going back. So, but what about if they refuse and their families decide to side with them? What methodology or what is in place for the ministry to definitely get them back by force? This is what is not clear. So we have a ministry that, is doing well by informing people, holding daily press conferences, but the content of information coming, it doesn't answer all the questions right now.
Yeah. Indeed. And again, Ibrahim, if I should go back to the confirmation of the third case and looking at the situation again, what exactly do you think we could expect from the government in terms of its decisions precisely on making people to take these things very seriously? Because if you look at generally the situation in the country, people are not that much taking the coronavirus seriously. Movements and dealings are not changing in somehow.
Yeah, so the government right now is relying on a goodwill gesture from the public, because there is no indication of the government being able to do things on their own for now. What they do is to hope that the public will understand and hopefully, try to respect the order or the suspension of public gathering. This is an issue. In the morning, we reported that if going out of town will make you realize that there is no, sign of banning on public gatherings. So you go to the Serekunda market, which is the most busy market in the country here. You find, the situation of open market is there, which we call Lumo. So this is also a concern that authorities at the municipality are, now raising up. So the government actually should take one more step further than just expecting that people will understand. The awareness campaign has to intensify, and more people need to be involved, because we cannot live in a situation, that's what Gambians will tell you, that where you have to take care of your own case by yourself. So the role of government as well as the public need to be properly defined now and not later.
All right, great update, Ibrahim. Just finally, of course, we have touched on several issues that have been highlighted during the press. If there's any other thing probably I didn't ask or we didn't talk about, if you can finally end the discussion on that.
Absolutely. And what we also note from the Ministry of Health, apart from this is the first case that is being discovered in the rural Gambia, now there is a permanent reception for the hotline number that is 1025 according to the ministry, where already up to 400 people have decided to voluntarily, come over for checking or for possible testing of the coronavirus. As you know, the ministry said that, with the calling of this number alone, will help them to evacuate you from your home. No one needs to try public transport in getting to health facilities. If you want to go by yourself, you better walk alone. But the idea is, to isolate, ourselves, isolate people, exercise social distancing, which is as a measure of prevention.
All right, many thanks, Ibrahim Presba, our man on the ground. Thank you so much for the information there you shared with us on the latest information and development of the coronavirus update or situation in the Gambia. And of course, the big news, of course, or the breaking news is that Gambia confirmed its third case, and this time it's happened in the Upper River region in Numuel, where a 71-year-old man who came from France has been confirmed positive. So that's the news, and of course, and other issues that we discussed also, you heard about what Ibrahim has said. Well, Gambia, we get to be more serious. This is not a play, it's not a joke. Coronavirus is a serious thing, and I think we need to be more decisive in decisions that we take, especially government. I especially mean here. But of course, that's all we have for you on this special edition on the update of the coronavirus in the Gambia. And as always, we say we'll keep updating you, and we'll keep playing our role as a media, house. And we thank you so very much, as always, for relying on Africa for giving you updates as they happen in the situation of that we find ourselves as a country, and of course the globe as well. We'll keep the fight, we'll keep also informing you accordingly. Thank you very much. Till we meet again in another time. Bye for now.